thank you, members of the Board of Trustees, for listening to what we have to say. As we sat through the meeting in October and then have heard from members of our organization in the meantime, we heard two options basically, that there stop being coverage for anybody who needs these prescriptions for weight loss, or that the cost for every single member of the plan would basically double in order to cover those costs. Both of those things put an onus on the plan members. And this is supposedly, the health plan is supposedly a benefit to try to bring people into state government. A state government that is at 23% vacancy overall, and in some prisons in excess of 60% vacancy. How in the world are we going to bring people into state government? Will we keep putting every problem that's not caused by employees back on the employees? So I'm here to ask a few questions. Where would we get the money if we don't get it from employees? Well, there's the legislature. To think that the legislature is going to bridge that gap, or Director Walker is going to recommend bridging that gap in the governor's budget, I think is unlikely. But I also think it's unfounded. If you do that, then where is the money? That's taking general fund money that would go to other very important causes like state employee raises, like other vital public programs. What we're leaving out of this equation entirely is what we leave out as a nation. We're leaving out the question of why. Why are the price tags what they are on these prescriptions? Especially why, in light of the fact that they are sold in Western Europe at a fraction of the cost. And we know the why. The why is because we allow this in this country. We encourage this in this country. It is absolutely unacceptable that we are getting hit on both ends, that a company that produces medication here in Clayton, North Carolina and in Durham, North Carolina turns around and puts a price tag 4 times what it is in most of the rest of the world. That is an insult, but for these employees, it's a matter of their health. Studies do show this helps. Employees are testifying it helps. If it helps so much, why make it out of reach and basically hold a ransom over everyone and expect the government to pay it and then not to be able to pay people a wage? This does get paid for by employees if there's not a better answer.